Hi, this is From the Heart, and I'm Leanne. And I wanted to talk about delayed cord clamping. And I guess before I start talking about that, I have to say that you are always the authority of your own health, your own life. No one can do that for you unless if you're unconscious or a child or you just can't do it for other reasons. A podcast is never the authority of that. Okay. So delayed cord clamping um, is just when a baby is born. Instead of clamping and cutting the cord right away, we leave it for at least 30 seconds. That's the definition of delayed cord clamping. However, different studies and different ways of practicing allow different times. So I guess to give a synopsis is I've been a midwife for 13 years, recently self-exiled from that life because I don't trust the system that we have to rely on. And, that's just my background. And I really still nerd out and love everything about birth. And so I think that the way to make the system more reliable and safer for people is in one part, for people to advocate for themselves. And so I'm just going to give a synopsis of some of the studies that I have recently reviewed and that show some either benefits or risks. And hopefully you get to do what matters to you at your birth or have a better understanding of what is happening at your birth. This is also an episode for not just people who are going to deliver, but it could be people who are biology nerds or just people like when I was 14 years old. This is the stuff I used to love, if you're a birth nerd as well. So basically, when the baby is born, the baby, we used to say that if we clamped and cut the cord, that would help the baby initiate breathing and it would reduce the chances of maternal hemorrhage. So after the baby is born is when a woman is at risk of having what we call a postpartum hemorrhage or excessive bleeding, and all women bleed after birth. And then when there's too much of it, we call that a hemorrhage. However, we know that delaying the cord clamping does not increase hemorrhage. We know that today. And I think it's been quite a while since we used to say that if we clamp the cord, it would help the baby initiate breathing. I remember that from practice, but I can't find any documentation that we used to say that to like the learners and people who would recertify in their neonatal resuscitation. So what happens is, when the baby is inside still, the baby gets the blood from the placenta through the cord. So that's how the baby gets its oxygen and everything else. And when the baby comes out, there's like a really huge transition for the baby to start breathing, but also the placenta usually continues to exchange blood with the baby. And there's actually one study that showed that the exchange between mom and baby continues up to potentially 10 minutes after the birth. So throughout my career, I've always heard something like 3 or 4 minutes. And it's this particular study showed that there is an exchange of blood even after we stop feeling the pulsation of the blood passing through. So it's because of that we see delayed cord clamping can be described as like after 30 seconds of the birth, or it could be described as 1 minute after the birth or 2 minutes after birth. And it can go up until the client decides to have her baby's cord clamped. And this is so my practice changed when Sylvie, we talk about it a little bit in our episode in the How to Advocate for Yourself. So she advocated for herself to have her babies have delayed cord clamping. And she had to a talk where a midwife from the United States was speaking about this kind of research. So she wanted to do some extra delayed cord clamping. That's her choice. And so we made it happen because she asked us for it. So basically what happens when the baby gets more of that exchange, the baby actually receives more blood volume, which helps with cardiac output. There's more blood to circulate oxygen around. There's also like just more hemoglobin, more stem cells. There's and then the research is quite consistent in saying that the iron levels for children is significantly higher, up to 4, 6, and I even saw 8 months. So longitudinal studies are harder to do. There hasn't been studies that look at the effects like until when the child is an adult. But that seems to be underway. But that will take a few decades to publish and set up and that kind of thing. However, we do know that iron stores affect the baby's development long term. So let me find it. I just want to summarize properly. So one study shows that at the 1 year age, if there is iron deficiency, even if there is no anemia, so that means that the hemoglobin would be low, it actually does influence the motor development negatively. While another study showed that children that are iron deficient they are affected cognitively with motor skills, social emotional development, and neurophysiologic development, even 20 years after successful treatment of anemia in childhood, in infancy. There's even a drop in IQ scores by 25 points at the age of 19 years. So just to kind of give you a little synopsis of how important iron is. Iron, if you really think about it, iron helps with the transportation of oxygen, and oxygen is what we need to get all our tissues and all our cells functioning. So it's obvious that it does have a significant impact on our development. And actually, because of what I just said, I'm going to skip to my favorite study. There was a study that showed that specifically delayed cord clamping, not treatment of anemia, but delayed cord clamping results in better myelin development. So what myelin is a fatty layer that protects the nerves. And there's more of myelin around the nerves that are the most important. So, and the formation of myelin is the most rapid in the first 2 years of life and is complete by the age of 30. When there is a problem with the myelin, we see behavioral disorders that are more common, and we can also see like when it's affected negatively, there's more. Oh wait, I forget. Multiple sclerosis. That's what it is. So this particular study was looking at delayed cord clamping at 1 minute versus 5 minutes. And if the group that had the 5-minute delayed cord clamping had a significant increase in ferritin levels, so iron levels, which was associated with greater brain myelin content at the age of 4 months. And so they were doing MRIs on those children, and they were doing like a physical checkup on those children, as well as blood draws. To me, this study particularly says a lot on just like the evolutionary purpose of how we function. We didn't evolve to have our cords clamped right away. If you look at the little thumbnail that I hope to use, you'll actually see my friend who just delivered her baby, and the placenta wasn't clamped or cut for its delivery, and the baby's cord remains attached to the baby when she's first born for however long they decided to do it for themselves. Just the one little thing that I would say about it is that there's some tugging on that picture of the cord, so they didn't leave the cord loose so that the transfusion can continue more easily. But you see that the placenta is elevated a little bit. So that's just my one thing that maybe you may want to look at if you decide to deliver your placenta and keep it attached. The other thing that I want to say is that there's this thing called the pause at birth. And because a lot of the studies suggest that if we leave a baby lower between the woman's legs, that there's a higher amount of blood that's transferred to the baby because of gravity. When we catch babies, we are really quick to kind of throw them on the mom. The mom wants to hold her baby, and of course she does. And but it might be beneficial to just take a pause, take a breath for yourself. It's a huge transition that you just finished. And the birth pause actually makes that transition really beautiful and smooth, and shows you how relaxing and good it can be just for, like, you're coming back to yourself, just a relaxation part before you hold your baby, because it's a bit of a shock, the whole thing. And then you could just leave your baby you just kind of explore your baby gently before you lift your baby up on you, and your baby catcher's hands can hold your baby, rub your baby's back if your baby needs stimulation and that kind of thing. My vision of what I just said is like, if you've delivered on your hands and knees, or if you've delivered squatting. But it's the same even if you were to deliver on your back. You can reach for your baby when you want to reach for your baby. That is something to discuss with your baby catcher first, because usually we just pass the baby really quick on your belly if you wanted that. I'll try to put like a link. I'll try to find what was written on the pause, because it's just really nice, and it was really simple and beautiful. Another thing that has not been studied is the stem cells that pass from the placenta to the baby. And so we have a bit of an idea, but honestly, we don't know the effects. So basically, placental transfusion can deliver several million to 1 billion stem cells. I believe that these studies were done on animals, because I don't think that we've done them on humans. But this results in like basically a stem cell transplant. So there is some talk about what do you call it? Banking the baby's cord blood. There have been some scandals, especially with the private ones that have come out. Some people pay, so you have to pay a few $1,000s at birth, and then you have to continue paying a few $100s for the next few years. And from memory, I didn't look this up for this episode, but from memory and from a few years ago, this could have changed. The freezing could go up to 12 years of age, and the stem cells could be used for if the baby had leukemia in their childhood. So the risk of childhood leukemia, I'm not sure what it is, 1 in blah, 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 I'm not sure. However, that risk is very likely small. And if you give all that placenta juice to your baby, we don't really know all the effects that does. So obviously I'm a huge fan of it. If you want to look into cord banking, go ahead. There are some places that do the public cord blood banking. What they do with the blood, I'm not sure. Is it research? Do they save it for your baby? I'm not actually, I don't remember. So you can do that research. In some, you might hear, if you discuss this with your baby catcher, they might say that there's an increased risk of jaundice in the baby, or different lab values, lab values. So the research, there are 1 or 2 studies that show that there is an increase in jaundice in babies. However, when you look at the total of research on those babies, there might be an increase in jaundice, but there isn't an increase in abnormal jaundice that needs to be treated. And if you look back into my last episode, I actually talk about the potential for what causes jaundice is the bilirubin. There's some evidence that it shows that bilirubin can be beneficial for babies. I linked it in that episode with the vitamin K. So you can look at those resources later. I believe that there's purpose to a lot of things that our body does, especially when everyone's body does it. And so for bilirubin, for jaundice, 60% to 80% of babies have this yellowing of the skin, just because babies have a lot of red blood cells when they are in utero, and they don't need as much when they are born. And then that red blood cell, that hemoglobin breaks down, and a part of that is the bilirubin. Okay, so some other studies. There was one about lambs, actually. I want to look at the lamb one. Okay, so it's not a study on lambs. It's a study on rats. After having induced brain injury, they show that study, or those studies show that cerebral damage can be prevented by infusion of umbilical cord blood if it's given 24 hours after the birth. So there's things that we just don't know, and we don't know the benefits of all of it. I was also reading that one of the advantages of delayed cord clamping could be that it could decrease the risk of hemolytic disease of the newborn, which is when a woman is Rh negative, and if the baby is Rh positive, the woman will then create antibodies for future pregnancies, which could then affect the future babies negatively. And the mechanism in which they think that this works is that there is more placental transfusion to the baby, so there's less blood remaining in the placenta, therefore reducing the risk of alloimmunization. due to higher quantities of fetal blood staying inside the woman or inside the placenta. So I didn't read the study on those, but I did see like a summary on that, and I thought that was interesting. And then the last thing is that now that we're seeing more and more benefits to the delayed cord clamping, and that if we clamp a baby's cord today quite early, it's because we are concerned about the baby not breathing, because a part of what we do for resuscitation is to help the baby breathe. So we would put a baby like a mask to the baby's face to breathe for the baby. And so if you were to take all the high risk, low risk, moderate risk women in one big group, the risk is about 3% of babies needing some help with breathing. And then the risk becomes smaller and smaller and smaller for like the additional kind of interventions. So like giving drugs to help with breathing and that kind of thing are the risk is very small. There's a lot of arguments. I saw a lot of synthesis papers around this that were really good. But then I do have one study that shows they grouped a bunch of about 70 some women who are at high risk of resuscitation. Not all those babies had resuscitation. However, they clamped the cord at 1 minute for half of those babies, and then they clamped the cord at 5 minutes for the other half. And for the babies that they've cut the cord at 5 minutes of age, they were resuscitating the baby on a new kind of bed. That's where the resuscitation can happen at the bedside of the mother, rather than what we do in most cases. We cut the cord and we resuscitate the baby like a few meters away. So, and the cord, like the length of the cord is something like on average 60 centimeters in total. So that would have to be done, basically between the woman's legs. They did it so the study demonstrated that 5-minute delayed cord clamping could be accomplished safely without compromising the ability to perform resuscitation, and was associated with increased cerebral tissue oxygen saturation and better blood pressure at 12 hours of life. And for the babies that got 5 minutes of delayed cord clamping, they had there was a trend for less resuscitation overall and improved APGAR scores. So APGARs they're not indicative of very much, other than they're just a way of demonstrating what was happening to the baby right at birth. So they're just a method of documentation so that healthcare providers can understand what has happened. It's just a score of, was your baby breathing very vigorously or not, basically. So this is just a summary of this study. We believe the longer delay yielded a greater blood volume and increased pulmonary circulation and cardiac output, allowing greater oxygen delivery to the tissues and decreased need for resuscitation intervention. Okay, so with that said, there are more studies that I could summarize. There's some on preterm babies, and prematurity is affected so differently at different stages. I just won't go into that, but there are some benefits to those babies. Some of the studies I didn't get to see where they were done, and so a low resource country is very different than a high resource country and that kind of thing. So personally, for me, I'm a big fan of delayed cord clamping. Some people might choose to do otherwise. But if I were to be pregnant, I would definitely tell my care provider that my preference would be that. I would want a very delayed cord clamping, I would say that I would prefer 10 minutes. And even longer potentially. So that could rack some people's nerves, your baby catcher's nerves or the pediatrician's nerves if they're in the room. Basically, if that's the case, you can always ask the pediatrician or the people who are assessing your baby to come over to you to assess the baby on you. I used to tell my clients that oxygen trumps iron. And so if the baby needs help getting oxygen properly in their lungs, that's when I would have to cut the cord, especially if the birth was in the hospital, because in the hospital, the equipment to resuscitate a baby isn't transportable and it's very big. So in some of the midwifery literature, they do talk about resuscitating a baby attached to the cord in the home setting. Of course, that's not where we prefer to resuscitate a baby because we don't have the team there, and we do like to keep our low-risk women, be the ones who deliver at home. But midwives are always ready for resuscitation. If you want the birth pause, you could always just tell your baby catcher that that's what you would prefer. What you want, you can discuss with your healthcare provider and what they've done and what they feel comfortable with. And so for a C-section, if you have a C-section, that's where you can ask for delayed cord clamping, but it won't be very delayed just because the client is also bleeding because she's cut open. So as the baby needs kind of, stimulation and rubbing of the back and that kind of thing, they can leave the cord pulsing for that duration of time. But beyond 1 minute, maybe even I would say 2 minutes would be like, I don't know if I've seen that. But beyond that, I have not seen. But if clients really want this and they want more of the resuscitation with the cord attached, it's the more you have these discussions with your baby catchers, the more maybe you talk to the people who bring in equipment into the hospitals or the birth centers, eventually those changes could happen. I do think that more research, obviously, because we in every sector of healthcare, more research is always kind of what we hope for. But long-term studies one day, which will take decades to get. The other thing is if your baby cannot receive delayed cord clamping as you wanted, at least you've had the discussion with your baby catcher, and your baby catcher will be ready to just explain why it didn't happen, and then you'll have better understanding of what has happened at your birth, and you'll feel more respected and that your choices were honored at your birth. Not everything, but a good chunk will be, I'll write the resources into the show notes. And I hope that you stay super healthy and oxygenated, and that this placenta juice episode was felt really nerdy as it did for me. Have a really great rest of your day.